And so what we're trying to do at Medesk really is make those decisions that are to do with the business as easy as possible for you to make. And that's not like making decisions for you as such, no. It's more about giving you the tools that you need to see the evidence for yourself as to what you need to do. So it can be lots of different things. So nowadays, these are some of the three main things that we've been covering for, the sort of into lockdown period, I guess you could call it, just to make sure people can actually stay afloat in the times that they're able to stay as open as possible. And so it's all about, which services are most popular and actually most profitable, when you're most busy, and whether your promotional work is actually worth it, really. And so what I'd like to know before I proceed and show you a few pie charts and different cool stuff that you can generate in Medesk without even doing very much, I want to know from all of you in the audience, if you can, what are you actually using to analyze your performance at the moment? So are you using any tools? Are you collecting any data? And if you are, or even if you're not, what are the things about your clinic that you would love to know? So for example, your most popular service, your most profitable colleague, clinical outcomes, that kind of thing. What would be most valuable for you to know? Okay, so Gina says referrals. So do you mean incoming referrals, I presume? So where your patients are coming from? Would that be right? Right, cool. So you will like what I'm about to show you then, I think. So one of the big things that Medesk is good at actually is capturing where people are coming from and showing you whether that's worth it overall. So I do have a few slides coming up that will address that in particular. And that's actually more or less what the advertising efforts, the third of this list, is about. It's not just about the cost of the advertising, but actually how many referrals you're getting and so on as well. So it's not just about the cost. You can use exactly the same tools for understanding referrals as well. So yeah, it's all interlinked. The only difference is one involves the cost of it all, the other one doesn't. So yeah, the most profitable services is always a good one to look at nowadays if you're restricted for time, and also you want to make the most out of the time that you've got. So what we can do is, as you go through the system in Medesk, as you go through making bookings, seeing people, all the rest of it, Medesk actually behind the scenes is capturing all this information. It's capturing what services you're offering. It's capturing how much they cost, how much people paid for it, how much it costs you to actually run that service. In other words, how much are you paying the doctor to actually run that service on a per appointment basis, and does that work out as a profit for you? And even in the case of a solo practitioner, for example, in the cost of the service, you can, for example, if you're hiring a room for an hour or day or whatever it is, you can actually put in the cost of a service, the cost to you, you can actually put how much it costs you to rent that room. So if you're paying £20 an hour to rent a room, then you can put that as part of the cost. What Medesk will do is work out whether that's actually worth doing. So it'll give you a percentage, and it'll give you the actual profit rather than just the revenue. And you can see straight away, even from just this, what's worth it, what's not, and then obviously you know what to focus on. So it's pretty handy. And this one of these reports like this comes as standard in our report library. So it's not like you even have to build it or wait for us to build it. It's actually it's right there, and then you just click on it, let it run, and it gives you everything you need to know for the past couple of months. It's always good to know when you're busiest. I find as well, especially if you're a solo practitioner or if your practice has got a bit of a skeleton staff situation and you need to know when to have people at the front desk, as well as you being there as a clinician. It's very important to know, because if you're renting a room and you have to rent for an entire day or maybe a half day, if you end up renting, say in this example, renting that room in the afternoon, or maybe having your receptionist come in the afternoon, if you look at how many appointments you're running and how much money you're making, you can see straight away whether it's worth it or not. And you can actually understand from this example here straight away, busiest time of day is 9 till 12 in the morning. You've got 53 appointments, nearly £4,000 of revenue, And you can use that information then compared to the rest to understand whether you want to say to your patients, well, we're only open in the mornings, or whether you want to make sure your receptionists and so on are only there then to greet the patients and handle the paperwork at their end. So it just cuts down on all those costs that you don't necessarily, it's not that you don't think about them, but you don't necessarily have the data at hand to truly make a decision as to when to close, when to open. So I think that's one of the very helpful things that we have. And to answer your question, Gina, so the way Medesk looks at referrals and advertising channels, social media, and all the rest of these kinds of things, they're all, like I say, they're all essentially the same thing. They're all channels through which people are learning about you and coming to you. So it doesn't matter whether it's purely a clinical referral and there's no money involved, or whether it's that you've paid for Google ads or Facebook ads or whatever, and people are coming in booking that way. Either way, the principles and the mechanism of it all are identical. And what I would say is the way Medesk works is that we use online booking to capture the location of the referral or acquisition channel. So, for example, what you can do is you can give each of your referral partners a unique link that they can use. And whenever they use that link to book a patient in with you, it goes straight into your schedule. You get a notification about it, and it tells you that it was that person. And what you end up with then, actually, is a pie chart, or donut chart in this case, actually. At the end of every week, you can look, or every month, or whenever you want to do it, really, and it will tell you how well you're doing in that regard. So you can see here that this particular period of time, 8 Facebook referrals. So in other words, patients have booked in for themselves via Facebook, via your practice page on Facebook or whatever. And you can see that contributes almost half of your appointments or patients. And you can see that you did the same in the last time period of that particular length as well. So you've not improved with your Facebook efforts, you've actually stagnated, but nevertheless, it's a big proportion. So it's not so bad, is it? And you can see down here, Dr. Jones, for example, you can see that he's given you a couple of patients, or she, and you can see that that's a 100% improvement on last month or whenever it was, because they probably had 0, I presume, or 1. So yeah, you can very easily find that out just at a glance, and you can make decisions based on that alone if you want. You don't have to dig into the stats any further. This is actually enough for you to get an idea of what's going on and to then have a broad idea of what decisions to make. You obviously then often will want to dig into the specifics of it, the actual numbers involved beyond this, to understand more deeply what to do specifically. But you will understand at least whether to cut something or to investigate it. And so what we've got in Medesk is one of the library reports that we've got looks like this. And what it does is it breaks down automatically all of your appointments that have come in, so all your new patients and new first appointments, and it tells you where that person found you and how much money is coming in on average from that particular place and how much in total. So what it allows you to do is compare those numbers against the amount you're spending on those particular channels in the case of advertising, or simply you can look at the numbers in terms of referrals, and who to thank for giving you so many referrals, even if it's there's no money changing hands, and you'll know what to do. You can also use it for things like we do. There's a new client of mine who joined us a couple of weeks ago. What they actually do is use this kind of report linked up with a percentage to understand how much to actually give their booking partners. So in terms of other booking systems and all that kind of thing, so they will understand what commission to give that particular software or that particular person, which can be quite handy. It incentivizes people to do that and help you. So yeah, I think that probably answers your question, Gina, with regards to referrals, and you can definitely see what's worth pursuing relationship wise and what's not.